I had came in earlier to inform the patient that I need to perform a dressing change on her upper left lower extremity. But before I got started, I asked her about her pain, and her pain level was severely high, which was a 10. So I medicated her with some pain medication that was ordered by the doctor. And I told her that I'd come back in 30 minutes, and I'm back 30 minutes later. I came to check on her pain level and hopefully proceed with her dressing change. Knock knock, can I come in?
Come in.
Hello there. All right, some
Hi.
privacy. I'm gonna wash my hands here really quick. Okay, can I ask what your full name is?
Yeah, Harpinder Sandhu.
Hi, okay. Can I see your name band?
Sure.
And what's your date of birth?
Call 795.
Oh, okay. So my name is Vanessa. I had came in earlier to medicate you regarding your pain that you had on your upper left lower extremity. How are you feeling?
A lot better.
A lot better? That's
Yeah.
good to hear. On a pain scale from 0 to 10, with 0 being no pain and 10 being your worstest pain, how would you rate your pain?
Like 2.
It's a 2? Okay, that's considered mild. So are you allergic to any medication or any medical supply that you know of?
No, nothing.
Okay, so I'm going to double check here. I'm gonna check your order here. It looks
Okay.
like your order is still active for a dressing change. Needs to be changed daily. And the type of dressing I need to perform on you is a wet to moist dressing change. And now I gotta see if I have all the supplies I need for this. Looks like I do have everything in stock. Okay, so let me grab my supply. It's right here in the cabinets. Okay, so I'm going to apply a blue pad under your leg. Can you lift your leg for me?
Sure, yeah.
Okay, how do you feel?
Good.
Good. Okay, I'm going to raise the bed up to where I can reach your wound.
Okay.
Now I'm going to wipe down my table here, and I'm going to apply a blue pad. Okay, and I'm going to take everything out here. I have a trash bag. I have normal saline, a camera, another normal saline, an abdominal pad, a super fluff sponge, a tongue blade, two Q-tips packages, my skin protectant that was ordered, a measuring tape, and I'm going to measure in centimeters, a little med cup to pour my ointment in, got a pen, and my sterile kit, which expires on August 20, 2022. And this is a basin here. Okay. So now that I have gathered everything here that I need, I am going to then wash my hands and put some gloves on. And the reason why I'm applying some gloves at this point is because I will have contact with bodily fluids, and I'm going to remove the patient's soiled dressing. Okay, so here I am going to start with loosening up the edges of the tape. And I'm going to then remove the dressing, stabilize the skin, and remove the dressing in the opposite direction. Here we have about maybe 5% serosanguineous drainage. Here we have about 5% serosanguineous drainage with slight yellow plasma on it here on top. And the first one was an abdominal pad. The second one was a gauze. And here we have another gauze, and this one has about 50% sanguineous drainage on it. Throw that in the trash. No purulent on all the soil dressings. Now I'm going to take the picture, or no, before I take the picture, I'm sorry, I'm going to assess the appearance of the wound and the surroundings of the surrounding of the tissues. Okay, so the wound is pink and moist, no drainage, necrosis, no any full odor. The appearance of the tissue is granulating. It's beefy red with velvety appearance. It appears with the growth of new blood vessels, the little tiny ones you see there, with connective tissue, no redness and no warmth surrounding the wound at this time. So now I am going to take a picture. Per facility protocol, the patient has signed a consent form. So I'm going to take a picture here. Okay. Now that I've taken a picture for our records, now I'm going to grab this normal saline, 0.9%. It's pre-packaged. So I'm going to open it up. And I'm going to take the little bubble out so it doesn't squirt all over my face. And I'm going to irrigate it from the center and work myself around it, staying within the wound, not going outside of the wound. Okay, and I'm going to discard of this syringe into the trash can. So now I'm going to remove my gloves and I'm going to wash my hands. And now I'm going to start opening up so I can start cleaning the wound and then packing it. So I'm going to start off with my sterile wound kit. I'm going to start with this first flap away from me and then open it from the sides. And then the last flap come towards me. And now in the center of this package is sterile. Everything inside is sterile. And here I have my 1-inch border, which is non-sterile. Everything around it is also non-sterile. So I'm going to start by opening up the packages. And I'm going to drop everything I need within my 1-inch border. With Q-tips, a tongue blade, a fluff sponge, and then I'm going to pour some normal saline into my med cup here. And I'm gonna open my skin protectant and pour some into my med cup here. Okay. And I'm going to pre-open my abdominal pad. Okay. And now that I have everything opened up, I am going to then reach over for my sterile gloves. I'm going to pinch it out. And I'm going to do it away from my sterile compartment there. I'm gonna open it. And you see these flaps here, I'm gonna go right underneath. And then pull it apart. Okay, so my left hand is my dominant hand. So I'm going to don my left hand first. Okay, and then everything is sterile here, everything is sterile here. So I'm going to grab it from the cuff and don my right hand. And I'm going to pull the cuffs around my wrist. And everything is sterile here. So I'm gonna fix my gloves. And I'm gonna pinch it here in the center and dispose into the trash can. So now I'm gonna come over here and grab one of my sterile Q-tips, which unfortunately they're all facing towards that way. So my hand is sterile, so I can touch anything inside. I'm gonna grab my Q-tips. And turn them around. Facing within the 1-inch border. Grab my metal tweezers that came with the kit. And I'm going to start forming a flower here. This is a 4x4 gauze. And this one here, I am going to leave it as dry. I'm not going to saturate this one because this one's going to absorb all the excessive normal saline that is in the wound for 5 seconds. And then I'm going to discard it into the trash 6 inches above the trash can. And now I'm gonna come over here. I'm gonna make another flower. This time I'm gonna saturate it. And I'm gonna come over here and I'm going to swipe on one side of the wound. Discard 6 inches above the trash can. I'm going to make another flower. And I'm going to saturate it. And I'm going to swipe on the other side of the wound and discard 6 inches above the trash can. And now I'm going to make my final flower here. And this one is not going to be saturated, as this one's going to be a dry circular motion around the wound, and discard 6 inches above the trash can. Okay, I'm going to put my tweezers down now, and I'm going to grab a sterile Q-tip, and I'm going to come over and measure my wound. My wound is about 15.5 in length. And it is about 2.5 centimeters in width and 1.5 centimeters in depth. So I'm going to dispose 6 inches above the trash can. And now I'm going to pack my wound. So I'm going to grab my fluff sponge. And I'm going to saturate it with some normal saline. And I'm going to squeeze the excessive amount of saline into the trash. And I'm going to undo it here, unfluff it. And now I'm going to grab a Q-tip. And I'm going to pack my wound. Starting on one side of the wound here. Making sure I stay within my wound and not try to be in contact with the healthy skin. Okay, and I'm going to discard of this Q-tip 6 inches above. Now I'm going to grab my tongue blade and I'm going to grab some of the ointment. And I'm going to dab it around the wound. And this skin protectant was ordered so that the healing process can go a little bit much faster. Okay, discard 6 inches above. And now I'm going to grab a 4x4 gauze. And I'm going to place it on top of the wet gauze. Okay. And now my hands are no longer sterile, so I'm going to reach over and grab my ABD pad, making sure I don't touch the inner part of this abdominal pad. And I'm going to put it right on top of the gauze, making sure that this blue strip is facing upward. Okay, I'm going to now tape it down to secure it, secure the dressing down. Okay, and then I'm going to initial my wound, my name, my initials, the date, and the time. It is about 1600. Okay, and now I'm going to discard of everything, all my equipment, and toss it into the trash. And ma'am, can I lift your leg so I can dispose of your padding?
Sure.
Thank you.
No problem.
Okay, I'm gonna take my gloves off. Discard in the trash. Dispose of it. Wash my hands. And now I'm going to make my patient comfortable. Okay, are you comfortable? Are you comfortable, ma'am?
Oh, yes, I am.
Yeah, okay. All right, so I'm going to lower the bed. And here is your call light.
Okay.
Do you need anything else before I go?
No, I'm good.
No?
Thank you.
Okay. I'm gonna wash my hands, leave the room, come to the nurse's station, and I'm going to document the assessment of the wound, the color, the amount of drainage, the type of dressing I had applied onto the patient, and how the patient tolerated the whole procedure. And that's how you perform a wet to moist dressing change.